So the highlight of tonight, and we've done this for a couple of years, is to hear. We can tell you all we want from a doctor's perspective, but we don't go through it necessarily. But we do have a patient. We want to hear what happens to the patient from their own perspective. So the couple times we've done this, we've had someone speak about this, and as they've been very gracious in helping us. So I'd like to bring up Dr. Carl Brown, one of my partners, to introduce this year's speaker, which is really a highlight of the evening. And by the way, I forgot to mention that this evening is being recorded, and so it will be available online at some point for you to share with your friends and coworkers. Thank you.
Great, thank you. So I'm Carl Brown, as was mentioned earlier, and I've been a colorectal surgeon here since 2006, and it's my pleasure to ask Mr. Koonar to come and speak to us about his experiences going through treatment for colorectal cancer. Mr. Koonar is a lawyer, which usually strikes fear into the hearts of physicians when they hear that a lawyer is calling and coming to talk to them. So, but we were heartened by the fact that he had chosen a career in philanthropy. In fact, a lot of the work he does is to help some of the patients that we have in the hospital in another wing, in patients who have alcohol and drug addiction issues. And so he has headed a charitable organization to help with the care of those people. In 2015, he heard the words nobody wants to hear, and that is that he had bowel cancer. And he will now share, no matter what part of the journey you're in, he'll share his experiences over the last couple of years and the ups and downs and the highs and lows of what that experience is like. The good news is that when we called him to ask him to come and give this talk for our group, he told me he was in Nashville having a drink with his daughter. So things do look up. Things do get, when things go well, they go great. And without further ado, I'll ask Mr. Koonar to come and speak to us, please.
No throwing tomatoes, okay? I'm a father of 4 children, so as this unfolded, I never thought I was going to get cancer. No one in my family had cancer, and I have, I was running, I was playing basketball, I was doing all kinds of things, and I started noticing that even with training, that I was slowing down, and I go, well, maybe I'm getting old, and I am getting old, and so so then I went in Terry Fox run, I think in September of 2014, and I was going, all these people are passing me, that's not very good. And then so I worked a little harder, and I trained, and then I went in a run in around December, and I went, no juice. And so I went to the doctor in early January, and my GP, he referred me to Dr. Sandpath in Richmond. And Dr. Sandpath, and in the meantime, in between my GP and Dr. Sandpath, I gave a stool sample, and I went straight to Sandpath after that. I didn't go to my GP. And he, gave me the test, put his finger up there and said, "You've got cancer." I said, "Well, that's a pretty smart finger, and he said, "I've felt a few of these, So he and I had a, sort of a conversation about it, and he said, "Well, next thing is a colonoscopy," and I think within about 2 or 3 days, maybe even a week, within the week, I had a colonoscopy, and he showed me on the screen as he was doing it, here's where it is, and here's what's going to happen, and he said, "You're going to go see Dr. Brown, and then they will organize something with the BC Cancer Agency, and you're in the mill." And once you're in the mill, it seemed to go sort of like, okay, this is what's going to happen now, this is what's going to happen, this is what's going to happen, so people just laid it all out for you, so you didn't have to really think about it. I mean, I think I was in a bit of shock at the front end. My kids say that I was playing it cool and I was being nonchalant about it, going, yeah, it's going to get fixed. And so that was sort of the start of the thing. After the colonoscopy, I think there was a scan that was required before I saw Dr. Brown. I went private and just got it done because I didn't know how long it was going to take. And then I took the disc with me when I went to see Dr. Brown, and he drew a little picture on the thing and said, "Here's what's happening," and said, "Now the next thing is you're going to get radiation and you're going to get chemotherapy." And I didn't know what that was going to look like. I kept trying to exercise regularly. I usually go 3 or 4 times a week, and I tried to keep doing that. And I was having trouble going to the bathroom. And the longest wait was between Dr. Brown saying, "BC Cancer is going to call you," and them actually calling me. I think it took about 4, 5 weeks, maybe 6 weeks before I got in to see the cancer doctors. And once I got to see them, it was fairly sort of, they had a procedure, you get 3 little tattoos on your bum, and that's where the radiation, how they aim the radiation, and then and the chemo doctor gives you some pills, and you take them every day. And it was 28 days in a row, except on weekends. As the joke was that cancer doesn't grow on weekends, and so I didn't really feel any sort of strong adverse effects. I kept working. I kept going to the gym. I kept running, and within about 3 or 4 days of the radiation starting, my bowel movements and everything got fairly normal, very, very quickly. I was very surprised how all of a sudden I went, that feels better, and and so I went through that, and I kept exercising. In fact, and then it's about a 6-week wait after radiation and chemo that you have to wait before they can do the surgery. And in that period, I went to Phoenix. I went hiking. I did a bunch of things, and so I was up and active, when surgery came around, I was feeling quite good. In fact, I was trying to talk Dr. Brown out of surgery because I'd run 5 miles the day before, and and I was feeling good. And thought, what the heck? There's nothing wrong with me. And then he explained to me, there's some dead tissue in there. We got to get it out, kind of thing. So we probably have killed the cancer, but we'll check when we're in there, sort of thing. So that was sort of the leading up to it. I asked my children. I said, "Did you notice any difference?" And they said, "Yeah, you were acting like a tough guy, but you were looking old. You were looking a little haggard." They said, one of my sons was just graduating from grade 12 at that time, and he said, "You had big bags under your eyes in the pictures." So there you go. and the feeling after the diagnosis was also, like, oh boy, how the heck did I get this? I have a brother who smokes, drinks, does everything under the sun, and he walks around, nothing wrong with him. I'm sort of going, I'm the one working out, and I've got the cancer. So, so anyway, that went all fine, and when we went to, then surgery came. Here's where the complications started. Surgery was fine. I came out of surgery, and I woke up, and I felt okay, and sore, but and then it's your bowel movements have to start, and it was explained to me that once your bowels get touched, they shut down as their initial reaction, and then after that, they'll start back up. Well, mine didn't decide that they were going to have a nice rest. They didn't start up for about 20 days, and so in that time, I was I was filling up with fluid. My regular weight's about 190, and one of the things it said was walk. You got to walk a lot. So I'd be walking around. I had the IV thing in. I'd be walking around the ward. People were starting to count my laps. They were making jokes about me and my walk. I was going down into the garden, walking around in the garden downstairs, and chew gum. So I had to walk and chew gum at the same time. So and so I did all that, and then finally they started, and then I went home. And so I came in for 4 or 5 days, and I was here for 23. And and I think at one point there was a scale somewhere on the ward, and so I used to walk by and see how much weight have I gained, because it's all fluid. And I think I went from 190 to 230 pounds. And then once it all started draining, I went from 230 down to about 160. So then they're all going, "You're looking emaciated now," so that those were sort of the complication side. Okay, so when he says some things can go wrong, well, they did go a little bit wrong there. But then I got the bag, and and they taught you how to do it, and you sort of learn. You sort of learn what works for you, when to eat, when to shower, all that sort of thing. You don't want to eat too much before you shower because then stuff will start coming out, and so you get, and if you're hairy, you have to shave around that spot so you have a nice tight seal and that kind of. So I had to do all those things, and and get the hair dryer and dry all around it, and so you got a nice seal. So I didn't really have any stoma issues. I was pretty good that way. I started walking, and walking was my exercise then, and so I would walk, for an hour or two, and then once after the 8 weeks had passed, I even put on ankle weights and walked that way, just because I didn't know what else I could do. So I'm pretty sure I wasn't allowed to do bench presses or curls and things like that because it was going to be too hard in the stomach, and then I was waiting for the reversal. I had an ileostomy, so it was going to get reversed, or hopefully get reversed. And I got tested for leakage after about 6 months, and I guess there must have been a little bit of leakage. And they said, "No, you're not ready yet. Go away." So I went away, and at this time, I got operated in June. I got out in July. Probably about September, I started chemo again. And Dr. Kennecke at the BC Cancer Agency said, "You're going to have 1 or 2 rounds of chemo." So I went for my first round, and he said, "Okay, another round. You get a blood test," and then so I went another round, and then he said, "How you feeling?" I said, "Fine." He said, "Okay, you're going to have another round." So as long as I kept saying I was feeling fine, he kept giving me another round. So finally I said, "My hands are starting to tingle now." And he said, "Well, are you feeling bad?" I said, "No, but my hands are tingling." And I said, "Now, how much more like each round," he said, is a better chance that you're not going to get cancer again." So I said, "Oh, that's fine. But, after about the 3rd or 4th one, what's the percentage?" I started asking him, "What's the percentage difference?" He said, "Forget it. You don't need it." So that was sort of the end of the chemo. So it was sort of a casual end to it all. And then I went a couple more times to the cancer agency. I guess they just did blood tests, and then they threw me out and said, "Get out of here, you're fine." And then came back for reversal. Reversal was at St. Joseph's Hospital, where I was born. So I told Dr. Brown not to finish me there because I didn't want to have a full circle come into one hospital. And that was sort of a non-event. 2 days or 3 days in the hospital, and I was out and home, and it took probably a good year to sort of get, your bowel movements and all that sort of on a sort of where you're controlling it all without any apprehension. And there was always a little bit of apprehension at the start. Sometimes you went 10 times in a day. That wasn't a lot of fun. Although I told that to somebody who's constipated, and he said, "Oh, you lucky dog." So there you go. So that was probably May. I got operated on for the reversal. By August, I went on a 5-hour hike up at Choco Lake, so it was, I was fine, in the sense my kids were with me, and they were sort of going, "Can you carry a backpack?" And I said, "No, you carry it. You're old enough," kind of thing. So I got out of a few things, and so they called me a faker when I asked them to give comments about how I was during that recovery period. It took a lot longer, I think, in a certain way to sort of what's going to be normal now. What's the new norm and I guess you always have an impression that you're going to go back to where you were, but I don't think you go back to where you were. You're going to be something different, and really it's just basically bowel movements. I mean, everything else is fine. I'm healthy. I can run. I can do whatever I want to do. I can't play basketball anymore because I can't get enough old farts to come out. and so, and I think life outlook changes. I think probably, I'm probably a little more flippant. I'm probably a little bit more prone to, on the spur of the moment, to go, well, like when they called and I was in Nashville, we were sitting I was sitting in my living room, and I was thinking, I had a 4-day weekend or a 5-day weekend coming up, and I said, gee whiz, I think I'll go to Austin, Texas. And my daughters talked me into go to Nashville, so off the three of us went to Nashville. So that was, I'm doing a little bit more of that, and I'm taking Fridays off, and I think next year I'll take Mondays off. So just sort of ease my way into retirement. And I guess things that I would change, I'd get checked. Really, I think the message of the whole thing is, and I told all my friends, and all my family ran and got checked as soon as they found out. So, it's, it's so preventable, and you just go, what was I thinking? Because of course you think you're invincible, and you don't need that. And and I have a bunch of friends who are doctors, and no one was pushing me to do it, and my GP never pushed me to do it, and so I was 63 when I got diagnosed. So probably if I'd been being checked from 50 forward, I probably wouldn't be here. So that's my story, and I'm grateful.
Thank you very much, everyone, for coming tonight. And I just want to take this opportunity to thank my colleague, Manoj Raval. Without his fortitude and pushing this forward and doing really an unbelievable amount of work on weekends and evenings, as well as our office staff, Anne and Lindsay and Suzanne, for supporting us. I mean, we are passionate about trying to help you and help patients with cancer. And so, events like this, if you have any feedback for us or any kind of information that we might be able to provide you that we haven't been able to do in the past, the project that Dr. Conklin is talking about, these are the kind of things that help the next generation of people who have the same problem. And the last thing I would say is that as you just heard, one of the best, the people in this room are our best advocates to try to, if you put us out of work, we'd be pretty happy, frankly. So if you got all of your friends screened and they got all of their friends screened at the appropriate time, and we saw a dramatic reduction in cancer, you'd see happy faces up here, frankly. So anyway, I just want to, again, ask for a little small hand of applause for Dr. Raval, who really did a ton of work.